Back with Dr. Gold from Connecticut. Dr. Gold, you're an ophthalmologist, a medical doctor for the eyes, kind of. And I have heard that there are LASIK surgery for the eyes is something very common these days, or not so common, but it's out there. It's advertised on radio and everywhere. However, you told me that there is something like an EPI Lasik, and that people are not quite aware about what the difference is and why. Can you fill us in?
Sure, I'll give you a little bit of the evolution. Back in the early 90s, the FDA approved laser vision correction, and it was performed using a procedure called PRK. In PRK, nothing was cut. There was no cutting. The surface cells were literally scraped off the eye, and that exposed the second layer down, and the laser changed the shape of the second layer down. The first layer grew back, and the vision was renewed so that people could see without glasses. In the mid-90s, a couple of ophthalmologists, one from Italy and one from South America, figured out that by cutting a flap in the front of the cornea, you could do the same procedure, but the healing was almost instantaneous, literally overnight. And so, worldwide, the rush was on to perform LASIK. In LASIK, a flap is cut, and there's relatively new information that the flap probably never 100% heals. And so I've become reluctant to do LASIK, and I much prefer a reversion to the original procedure, but we use a mechanical device to take off that first layer of cells. It's called an epikeratome, so the procedure is called an EPI Lasik procedure. The quality of vision that we can produce is better. The safety factor is hugely better because there's no cutting into the cornea. It takes a little bit longer for EPI Lasik to heal than LASIK, but during the healing period, which is basically 3 days, there are no restrictions on the patient's activity. There are special bandage contact lenses which are placed, and the patient goes about their normal activities during those 3 days.
Okay, so it takes a little bit longer to cure, but by longer we're talking a couple to 3 days, right? Altogether.
Yeah, that's correct. With basically no restrictions.
Okay, and even there, life is not completely dead. You can still operate during that time.
Oh yes, the vision is great, and patients are completely functional in terms of reading, watching TV, working, using a computer, all of those aspects of life.
Right. So, summarize one more time why the benefit of EPI Lasik is better. Like, what is it you do not hurt, and by doing so, did you have a longer? Is there, because there must be a time frame, or maybe there isn't, of how long a LASIK surgery lasts. Is this one lasting longer, meaning you see longer, or rehearse the whole thing again, please, because this is it's simple for you, but it's not so simple for us.
I understand that. In EPI Lasik, there's no cutting. In LASIK, a flap is cut into the cornea, which is then folded back in order to expose the third layer down of the cornea to create the shape change with the laser. In EPI Lasik, the shape change with the laser is in the second layer down, and there has been no cutting. That makes it a safer procedure. As far as how long the procedures last, that's equal, and they last indefinitely. There's no sense that the laser vision correction will wear off with either LASIK or EPI Lasik or PRK as it was originally devised.
Got it. What about the normal LASIK? Does it also last indefinite? Both of them last indefinite?
Yes, both of them do.
Okay, good thing. So basically we're talking less cutting, and less cutting always is apparently, we all like it. Nobody even likes to get his blood taken, which has a tiny bit of cutting involved. And the whole medical field is doing non-invasive or less invasive or minimal invasive. So really what you're talking here is an extremely non or minimal invasive surgery, because you're really not cutting, so maybe the word surgery is not even apt anymore.
Now, clearly the word surgery is appropriate, but it's much less invasive than LASIK surgery to do EPI Lasik.
Great. All right. Wonderful. Thank you very much. Very interesting. Very interesting.